Hi, good afternoon. Thanks for joining us for the Inclusion Monthly webinar. This is Rebecca Amnott with the Office of Early Learning, and with me I have
Lisette Levy. Hi, everybody.
And we are going to go ahead and get started because we do have a full agenda today and a great guest speaker that I think you all will enjoy. So before we get started, Lisette, we just have a couple of announcements. Lisette wanted to show you all our inclusion page, which is now on the OEL website and is housing the previous webinars that we've been having. And so if you click on the different webinar titles, it'll actually take you to a YouTube link where you can view those webinars that we've had in the past. So if you've missed them or want to go back and review, they are there for you and available to access there. The way to find this page on our website is to go to our homepage, floridaearlylearning.com, or on any page of our website. If you hover over the statewide initiatives on the purple bar here, and then go down to inclusion, and that'll bring you to this page where you'll be able to access it, and you will be able to continue to upload our monthly webinars here for future reference as well.
Yeah, today's webinar is going to be there too. So I thank our team for helping us putting there, and you can copy the link, send it to whomever, and the more than they see it, the more than we can share this information. The second announcement that we want to share with you is that we are aware that in the portal, 80% of the parents are opting for not screening their children. We are aware of that, and we are working on fixing that. We just wanted to let you know that we know that information, and if you could get together with your CCR and our teams as well and reach out to parents if necessary to explain the importance of screening. At the same time that we're going to be working on fixing that in the system so this stops from happening. So if you have any questions or comments, feel free to email me, and I will always take your voices and your thoughts and concerns to my leadership. So I'm going to give it back to Rebecca.
Okay. So just a little bit of housekeeping before we pass it on. As you all know, probably because of our format that we continue to have, we do have all of the attendees currently on mute because there are quite a few of you all joining us today, which is fantastic. If you have any questions throughout the webinar, please type them into the questions box, and that helps us to maintain records of the questions so we can go back and follow up with you if we need to. The questions box works better for us than the chat box, so please use the questions box. And if you all, now that I've told you to use the questions box, could go ahead and type in yes if you're able to hear me in the questions box. Now that we've done several announcements, hopefully you can hear. Okay, and I'm seeing that you are able to hear. Fantastic. So again, we'll stop throughout the presentation and check for questions and ask for our presenter to respond to them as we go. And now to our presenter. Today we have Mr. Zackary Gibson, and he is the Chief Child Advocate and Director for the Office of Adoption and Child Protection for the Executive Office of the Governor. And I have the privilege of getting to work with Zach on our statewide interagency review team, and he's going to tell you a lot about that, some of the work that we're doing at the state level and how that translates to you all at the local level, and hopefully will help with continuity of services and help with that so that we're not duplicating services across agencies. So with that, hopefully I didn't mess up your title, Zach, but with that, I'm going to pass it on over.
Thank you, Rebecca, and to Lisette, and good afternoon to everyone. Thank you so much for the opportunity to be a part of this webinar. We're going to be talking today about the Florida Children and Youth Cabinet's interagency agreement that is designed to strengthen collaboration and coordination for children with multiple or multi-service needs, a systems approach. So we've got a lot of great information. Hopefully it'll be applicable to the work that you do. And we certainly, at the end, have some questions that we want to present to you to kind of consider, how does this all work with your system of early learning? And when you encounter situations that are sometimes challenging or difficult to deal with, how can we work towards resolution? And if we're unable to achieve resolution, how can we access for additional supports for that? So with that being said, let's go ahead and go to the next slide. Today, as I mentioned, we're going to talk a little bit about the Florida Children and Youth Cabinet. Hopefully, many of you are already familiar with the cabinet. I have a quick slide about that. And then we're going to talk about the history of the cabinet's interagency agreement to kind of give you some background perspectives. And then we're going to go into deep about what is this agreement all about and how can this be a support mechanism to you. As you see through the overview here, we're going to talk about access to local points of contact. We do have two handouts that are on this webinar. One is for the actual PowerPoint. The other one is a draft copy of a quick reference guide that I'm going to be speaking about, because we do have early learning points of contact listed in that quick reference guide, and I'll explain why it is that we've included that there. There's also one other attachment that I neglected to provide the Office of Early Learning in advance, but we will be providing that, and that's going to be a list of contacts for our SEDNet representatives throughout the state, along with the Department of Children and Families Community Development Administrators. They're the ones that help convene our local review team process that we're going to talk about, and that document will be coming afterwards to be able to assist you all in identifying points of contact in your area that you may want to reach out to either seek, have any questions, seek guidance, what have you. So, but we'll talk more about that at the end. So next slide, please. So the Children and Youth Cabinet was created in Florida Statute 402.56. It's been around since 2007. This cabinet is the governor's cabinet. The governor will chair it or will identify a designee. Currently, former Secretary Wansley Walter serves as the chair of our children's cabinet, and we provided icons of all the different agencies that are a part of this cabinet. And we have a pretty robust list of agencies. So all the child-serving agencies in our state, along with representatives from our House and Senate, the Attorney General's office, the Chief Financial Officer, Attorney General, I may have mentioned that twice. We got a school superintendent. Director Rodney McKinnon serves as this. So we have an eclectic group of leaders that come together. And as you can see from the mission, I think we have one of the longest mission statements. I have yet to memorize it, but I'm working towards that. But the emphasis of this mission is about promoting interdepartmental collaboration and program implementation. We want to provide holistic supports that enable children and youth to be able to develop healthy, safe, and to transition to adulthood where they can become productive and self-sufficient. And if we think about system frameworks, if there's a system we want our kids in, it's the education system, knowing that that's going to create the greatest opportunity for them to achieve that transition to adulthood successfully. Next slide, please. So the Children and Youth Cabinet originally came up with this cabinet agreement or interagency agreement back in October 2012. When this agreement first came about, there wasn't a lot of fanfare about it, but it was a focus of our cabinet to really look at how do we address needs of children who are already in one of our systems who then may touch another system. An example of that is a child may be involved in our child welfare system and then may do something that results in them becoming involved in the juvenile justice system. So how do we manage that effectively? And when issues arise, how do we convene together in order to resolve those issues? In 2017, in December, we came together as a state review team after the first 5-year period of this interagency agreement, and we worked to revise it to enhance it with a focus specifically on promoting collaboration coordinate for children served by, and I underline, or at risk of being served by more than one agency or system. That distinction is very key to this agreement because it emphasizes our focus on prevention and early intervention services. And that is where we really want to focus our efforts, knowing if we can keep kids out of the state system, they're definitely going to be better off, but hopefully too, we can help families and the children navigate systems, get the help that they need in order to enable them to remain in the education system. As we talk about this agreement, the cabinet was very inclusive of everybody and anybody who works with children, that there's a mechanism that they can access in the event that they're unable to resolve an issue related to a child in their program or in their system. And we'll have some visuals that will articulate that more. Next slide, please. So with this cabinet agreement, again, it was revised in 2017. We have posted this agreement on this website here. If you click that link, that'll take you, and we provided some instructions because you do have to do a little navigation on the page. But this website here will enable you to actually access the complete interagency agreement. It's about 60 or so pages. But in addition, we've also included attachments of our interagency process framework that we're going to be talking about later, that will provide additional perspective of what this interagency agreement is. We felt that it was important to create a visual about this agreement, knowing that probably none of you want to take the time to read a 60-page document of an interagency agreement and try to figure that out. So we created a visual to help conceptualize what the process looks like when it comes to interagency collaboration. Next slide, please. This next slide provides a screenshot of what the page that, if you do access the website, this is the page that you will see on this website. As you look, we have a key point of contact, Ms. Jennifer Prather, with the Department of Children and Families. She's our representative from the department that helps in coordinating this interagency agreement. The Department of Children and Families serves as the lead agency for convening what we call local review team meetings, and we'll talk more about that. But this is the page that we wanted to share with you to help you with accessing local or regional points of contact. And as I mentioned earlier, after this webinar, we're going to upload a document and send it out with local points of contact for our SEDNet representatives, as well as our Department of Children and Families Community Development Administrators. Next slide, please. So with regards to this cabinet agreement, the whole premise is creating what we call review teams. So many of us are familiar with the term multidisciplinary team or multidisciplinary staffings. This can involve folks within our agency that come together to resolve a case, or it may involve folks outside of our program or organization that we invite in, who are our partners, to assist us in resolving case-specific issues pertaining to children. They may have mental health needs. They may have substance abuse needs. They are at risk of going into one of our systems. We convene together through these multidisciplinary staffings to figure out what can we do to provide stability and supports to the kids and families to prevent that from happening. But in the event that none of those things work, we've now created through this cabinet agreement a process that can actually escalate the case for additional supports to assist. If you look at the first check mark, the key point to that statement there is about facilitating connections to navigate systems. As we all know, our systems are complex. And many times we are saying, hey, just go to this website and look for this information. Well, unfortunately, some of our families have a lot of difficulties in doing that. Our ability to provide assistance to families with navigation, but more importantly, facilitating those connections, is really key to the work that we do. If you look at the second check mark there, collaborating on developing resources and strengthening our system of care. System of care is a term that it's a lot of talk here in Tallahassee. Hopefully you guys are talking about it in your local areas. But when we think about system of care, we're thinking about one state system of care that is really comprised of 67 local systems of care. And when those things are working together, we actually can get a lot of things done. But as you know, there's a lot of challenges within our systems. And again, how do we know who the right people are in order to get information or to access services? Because I believe in half the battle in life is knowing the right person to talk to. And if we can facilitate, build a rapport and relationship with that person, they can assist us in facilitating those connections, help us navigate in order to come up with resolution. We, as I mentioned, created a process framework visual to help conceptualize what this interagency agreement process is all about as a way of promoting communication and coordination. And then based upon the data collection that we'll do that we'll talk more about, the goal is to provide recommendations back to the cabinet on data patterns and trends as a way of, enabling the cabinet to decide, do we want to, propose any policy changes, changes in legislation, what have you, as a way of strengthening the work that we do through this cabinet agreement. Next slide, please. All right, so here's the visual. So I want to give you a moment just to kind of let it soak in. But as you can see, it escalates up through this process framework. This is the general state process framework visual that we have. We are currently developing individualized process frameworks for each judicial circuit in our state. We have 20 judicial circuits that may have one or more counties within a judicial circuit. That is how we structure all of our different work here based upon judicial circuit maps. So in your particular area, some circuits have theirs already. We're still working with others to identify, maybe they have a unique name for their local review team versus just local review team. But if you look at the visual here, you see the different shaded boxes. If you look to the left of the light gray shade underneath the heading of agency and school review process, these are the typical processes that would happen within your organization when it comes to resolving issues or needs of children within your programs, where if the child has an issue, the agency or school will maybe convene with the parent and the child and try to figure it out. And if we're unsuccessful in doing so, we then escalate it up to a multidisciplinary team or multidisciplinary staffing that, again, may involve folks just within your organization or may invite folks outside the organization to come in to figure out what can we do to resolve this issue to keep the kid within the system that they're in. And when those things fail, there's now an ability to seek assistance from a local review team who can convene all the other agency partners as needed to come together to review background information and to assess what else can be done to provide resolution to this issue that results in keeping the kids out of our state system, aka saving money for the state, but more importantly, helping access services and supports that can result in keeping them within your education system of the work that you guys do. And then, of course, if the local review team is unable to resolve that issue, then they have the ability to escalate up to a regional and then ultimately to the state review team where it comes to our level. And as Rebecca mentioned, Rebecca is our Office of Early Learning representative on our state interagency review team. You know, she is a great resource for all of you. So should you have questions, anything related to this process, she's a great point of contact, and she can assist in facilitating connections to get you the supports that you need. So again, we felt that instead of trying to review a Word document of 60 pages through this interagency agreement, that this visual helps conceptualize what this is all about and provides that visual, the visual of the escalation of how cases may rise to the next level and what those levels may be. So again, this is a great visual. This visual is actually one of the attachments on the website that we talked about earlier. So we encourage you guys to download it so that you can kind of have that maybe on your wall as a reference guide to keep in the back of your mind that if you're dealing with cases that you're just having a difficult time, you just don't know what else you can do, that there are supports and contacts that you can reach out to seek assistance on figuring out what can we do to resolve the needs and issues within our state or with the children as well. All right, next slide, please. So I included this slide related to SEDNet because SEDNet is a key partner in this process. Now, SEDNet, of course, deals with school-age children. SEDNet works very closely with our school districts, who many of them implement what's called a multi-tiered systems of support. So in essence, the districts, many of them have their own intervention processes as it relates to, the agency or school dealing with an issue and then escalating up to a multidisciplinary team. Within that kind of school environment, they will implement these multi-tier systems of support to provide universal, targeted, or intensive services to youth that is designed to ensure their academic success. But in the event that the problems are beyond what maybe the school or the family may be able to provide, that's where SEDNet can come in, offer additional supports, assess if the district has done their due diligence in convening folks together to resolve this issue. And if we're unable to do that, then the SEDNet project manager can then escalate the issue to seek assistance from the local review team. I provided SEDNet as an example because as I talk with Rebecca, we talk a lot about how inclusion specialists serve kind of in a similar role that SEDNet may provide to be able to assist early learning coalitions with access to services and supports maybe from the communities. But in the event that we're unsure what we can do, we, again, have the ability to reach out to our SEDNet points of contact as well as to DCF to seek additional guidance or support and even to an escalation to this local review team for additional assistance. Next slide, please. So as a part of all this process, each judicial circuit team is required to have monthly meetings at the local, regional, and state level. Rebecca can attest that we meet on a very regular basis, on a very regular monthly basis, as a state review team to review the data that's submitted by our judicial circuits to assess, what are the trends, what are the gaps that may be coming up, and what are the recommendations being provided to the state review team as a way for us to kind of review that, identify if there are already existing solutions that we can go ahead and share to resolve that, or if that's something we need to bring to the Children's Cabinet to have our agency leadership review that and decide, does it require additional changes in policy or legislation or rule development or what have you. Or maybe it's just a system operations issue that we need to refine, or what we really need to do is just bring people together to talk. And many times that's where we're at. We many times get so involved in the work that we're doing that we lose sight of the additional partnerships that we have that can offer assistance and support to assist us in resolving cases. So, again, this whole process is designed to facilitate connections and bring the right people together who can initiate action to resolve issues and cases. As a part of our monthly review team meetings, in some circuits, they may do actual case reviews where a child has an issue, and then the Department of Children and Family staff will convene the right people who can assist with resolving that case, review that case, develop recommendations and action steps in order to assist in addressing those needs. In the event that there are no cases, we look at the previous data in cases that were reviewed earlier to see, are we seeing trends? What is that data telling us at the local level? It's also an opportunity to really assess our local system of care. Again, we're in the process of working to create a visual to conceptualize what is our local system of care look like. You're going to see a visual, it's a very involved visual that was my first iteration of creating to conceptualize our state level perspective of what our state system looks like. But we are refining that, and then ultimately we want to create one for our local system of care to present to each circuit so that they can convene their leadership and other agency partners to the table so that we can all look at this generalized system of care for the local level and begin to break it down to build it back up so that we all begin to see things from a similar perspective. We can further increase the information on our resource directories, know other resources that are out there that maybe aren't already a part of our lists, but hopefully too to be able to refer for services if it's beyond the scope of what we currently offer. The last thing I wanted to mention, that these monthly meetings are great opportunities to share agency-specific updates and best practices. Specifically regarding early learning, what are events and activities that you have that are designed to engage kids and families in the work that you do, and how can our other partner agencies support your work? Many times, we all deal with families that have young children, and it's important for all of us as agency partners to be aware of all these resources, who are the right people to contact, so that all of us have the ability to facilitate the connection. Next slide, please. So this is the visual I was telling you about earlier. There's a lot of stuff on here, but the reason why I showed this first iteration of this visual is just to begin to help you to conceptualize what a state level systems perspective may look like. As you see at the top there, we have all of our different state agencies who serve children and families. On the outer edge, that's, if you look to the left under the socio-ecological model around public health, that's where we're talking at the public policy level, the state, local laws and regulations. And then as you go if you move inwards towards parents, child, and caregivers, you see the other levels of community, organizational, interpersonal, and individual. Those are all levels that impact healthy development and safety for kids and families. And one of the things that we're also looking at a lot is visuals related to public health. And I bring that up because there's a term that you're hopefully going to start hearing more about, and that term is called social determinants of health. Those are conditions in where we live, work, and play that influence our health. And we know that when children experience stress, families experience stress and adversity, it may result in other issues coming about that may prevent that child's ability to be ready to learn when they come to your programs. So really looking at social determinants of health, some examples of social determinants of health are certainly, basic needs, having a shelter, having a home, having access to foods and clothing, having job to financial stability, right? You need to have a job in order to be able to provide for your family. So how can we all facilitate the connections in order to help our families that we know will also help their children be ready to learn as they enter our programs and hopefully grow and achieve throughout our programs so they're ready to transition into K-12 education, pre-K-12 education more successfully. So again, this is the first iteration of this. There's other visuals we're working on, but I wanted to share this to kind of help you see that it's crazy, right? There's all kind of different agencies listed on this visual, and each of these agencies have their own processes and ways in which they operate. And our goal is to identify who are the right people to talk to within each of these agencies so that we can get closer to figuring out what we can do to address and resolve the needs of kids and families. Now, I can tell you, me personally, I have points of contact in every single one of these state agencies that if anyone was to call me, I can at least connect them with either the right person within that agency or at least somebody who can get us to the right person. And the goal is, as we create this at the local level, can we all have that same ability to know who are people within those agencies who can either help us resolve issues or help us get to the right person to resolve issues. Next slide, please.
Hey, Zach,
yes.
Sorry to interrupt. We did have a couple questions pop in, and so if you don't mind, we'll go ahead and get those out for you to respond to. So one of the questions was, is there a plain language version of the interagency agreement, or how does one request that a state document or an agreement like that to be translated to plain language?
Well, we feel that the current agreement is as in plain language as possible. I don't think there's anything in there that speaks to anything that would provide anything that's confusing or anything to that nature. And certainly, if you go back to the slide of the process framework, that's why we created that visual as a way of conceptualizing what this is really all about. Again, we can try to read the agreement. Again, it's pretty straightforward language, but I think part of the challenge that we all have sometimes is when we read a document and we begin to conceptualize what that may mean to us, we all develop different visuals in our head. as to what this means that further prevents us from being on the same page when it comes to resolving issues. Again, that's why we created that process framework visual, because by looking at it, hopefully that has helped create the picture in your head. And then as you work with your partners in your area in following this process framework or figuring out how do we continue to refine, improve, and strengthen that visual serves as that baseline that we're all familiar with and we can use as a guide for our discussions and further action that may be needed. If
Great.
for any reason, Rebecca, that somebody has a particular question about language that's in that interagency agreement, please let me know. I'd be happy to provide additional information or feedback on that.
Yeah, and we're getting comments and saying that the visuals are very helpful in understanding the framework.
Awesome.
and using that along with the document would also help.
Okay.
So thank you for responding to that one. We have one other question for now. It's from Kathy, and she's asking, who schedules the monthly local meetings? How do we find out about them? And is it appropriate for the Early Learning Coalitions to attend those meetings?
Absolutely. So as I mentioned earlier, I apologize for not having this document already as one of our attachments, but we're going to be providing you basically a document that lists each SEDNet point of contact in every judicial circuit throughout our state, along with the DCF, Community Development Administrators. The DCF Community Development Administrators are really key points of contact that can assist you with accessing the local review team process or just giving you guidance around particular cases that you're having challenges with and maybe you're not sure how to move forward with. So we will be providing that document so that you have those points of contact that you can either email or call to speak with them about what's going on. And DCF typically is the one who convenes the monthly meeting. I know in some circuits they have delegated that to maybe their CBC in their area because they play a big role in a lot of this work, particularly if the CBC is the managing entity. So I know in here in Tallahassee in Circuit 2, that's kind of how it's structured, is where the CBC actually is the one that convenes what they call their local review team. They call it the Child and Family Challenge Staffing. So that's the local review team name that's used here in this circuit. And the CBC here is the one that actually convenes it. But if you speak to any of the DCF folks, they can provide you information about when those monthly meetings are. And by all means, it's more than appropriate for early learning to participate in that. Matter of fact, we want to encourage that. And if anything, it's just a great opportunity for you to be in the loop with what's going on with our other agencies. You know, many times at these monthly meetings, we may talk about public awareness topics that really touch all of our agencies, that each of us can use as platforms to show our support of a particular initiative, but then speak specifically about what does our agency do to promote, the health, safety, and well-being of kids. I can tell you, hopefully I can convince Rebecca and Lisette to allow me to maybe be a part of a future webinar, or at least provide you information on the state's public awareness topics that our children's cabinets has identified as issues that all of our state agencies should be supporting. So we can provide that to you either at a later webinar or at a later date for you guys to kind of look at to see how can we use those public awareness topics as platforms to speak about the work that we do within our organization. So by all means, we really encourage early learning to be a part of that. And then if it's appropriate, Rebecca, I'd like to encourage folks to click on the handouts button and to look at the C5. All right, let me make sure. Yeah, the C5 QRG, which is called our Quick Reference Guide. We provided a draft version of that because we wanted to show you, the document that we provide our department staff to use as a quick reference guide when it comes to when an issue arises, depending upon what the issue is pertaining to, who are the key points of contact, and how do we facilitate the connection. The goal of this document, once it's finalized, is to be able to share that with all the key partners of all the different systems within our judicial circuit, so everybody has a copy of this. So when issues do arise, we can use this quick reference guide as a reference point to know who else should we call to get additional information or supports, or, what else can I do to assist this family in accessing services. So please take a look at that. If you do have questions about the quick reference guide or anything in the future, please let Rebecca know or myself know. We certainly want to provide that information to you so that you're aware. And again, as each circuit gets their quick reference guide, they're reviewing it, along with reaching out to all their other partners to talk to them about this so that we can ensure we have up-to-date information. But more importantly, that quick reference guide is a tool that is shared with all of our partners. So when issues arise, each of us now has an ability to help that family maybe either navigate or say, hey, here's the right person to talk to here that can assist you. Maybe we do a warm handoff by helping the family make the call, making the introduction before we pass it on, so the family doesn't have the anxiety of having to deal with another state agency person or whatever they may think. It's an opportunity to facilitate the connection, and certainly the goal with doing all this is so that we actually begin to decrease the number of cases that are escalated to a local review team. We want to develop and strengthen our communication and coordination with all of our system partners as a way that we know where we can navigate and seek assistance that can prevent kids from entering our state systems of child welfare, juvenile justice, corrections, that really do cost a lot of money to our states. So we want to prevent that from happening, but more importantly, provide greater supports at the local level, because you are the ones that touch kids and families. And we need to support you from the state level, support the local work, because that's where the magic is happening. And that's where we're all going to get the outcomes that we're all desiring. And if, as a state, we're not supporting that effectively, then none of us are going to achieve those outcomes, which is why the cabinet came up with this as a way of further strengthening the supports that we can provide at the local level. So hopefully that answered that question, Rebecca.
It did. Thank you so much. And we don't have any other questions at this time.
Okay.
Thank you.
Yeah, you're welcome. So this slide that's currently on the screen, the confidentiality and protected health information, this is a big factor. We are adamant about ensuring that we are protecting confidentiality and protected health information. The guidance that we currently have is each agency or entity that's involved in a case review process must follow their agency's protocols when it comes to sharing of information. But I think the most important thing that when we do share information, that only information necessary to advance the resolution of the case is what is shared. So that's a key piece, because for some of us, we want to know the backstory. We want to get the scoop. Well, getting the scoop doesn't necessarily help us resolve the issue. Now, granted, there is the need to access background information to better understand what's been going on, but more importantly, to know what has already been tried that has been unsuccessful, so that we know we're not trying to do the same things over and over again. But as we convene these staffings through the local review team and talking about unique cases, the goal is to have only the agency representatives that are applicable to the particular case, and that only information necessary to advance the resolution of cases shared. So this is an important piece for all of us to be aware of. And then certainly, too, as we develop rapport and relationship with our other key points of contact throughout the state, then, of course, we're going to have greater comfortability in speaking with them about cases that hopefully get us closer to resolution, so that it prevents children from entering our state systems. Next slide, please. We have developed an online data collection system. We currently use a SurveyMonkey tool that basically helps us capture data as it relates to the cases that have been escalated to a local review team. I just want to reemphasize the importance that before a case is escalated to a local review team, that there's due diligence being done at the local level through that multidisciplinary team or that multidisciplinary staffing that must occur to resolve the case. And if that is unsuccessful, then at that point is where a case then can be escalated to a local review team. When that case is escalated, we have a listing of questions and information. As I mentioned, DCF serves as the lead agency, so they're the ones responsible for capturing that data. And then in turn, they submit that to the state review team by the 5th of every month, where we review it, we process it, and we send back that data to the local group. So at one of those monthly meetings that the circuit may have, that's where the data is shared around what's going on here in our judicial circuit related to cases that may have been escalated to a local review team because they've been unable to be resolved within that particular agency or school setting. And that also would include early learning settings as well. So we feel that this data collection is a really important piece. This data collection process has been an evolution process. When we first started this, we really just captured very high-level data. And then when, as a member of the Children's Cabinet, I am the representative on our state review team for our Children's Cabinet, when I would go to our cabinet and present information, the data was so high level that it really never gave us any good content to be able to figure out what our next steps were. So as a result of the work of the state review team, we have really worked hard to assist our local folks in providing, instead of just providing open-ended questions, of having a list of items that folks can check off. We wanted to make it as easy as possible, but more importantly, still capture the information needed to help inform any potential decisions that we need to make. I can tell you, for those who may have been following the governor's executive order after the Marjory Stoneman Douglas incident, that executive order has brought additional support and strength to the importance around interagency collaboration and coordination. So it really supported this interagency agreement because it really brings together all the same people that are listed in the executive order that are supposed to be part of our local review team process anyways. So it added a lot of value to that. And, when the governor first put out that executive order, the first step of all of the meetings were to hold 3 public meetings with identified agencies. That was DCF, the managing entities, DJJ, Sheriff's Office, and school districts, to all come together to talk about how are we going to address school safety issues within our school districts. Now, while that has been done at the district level, certainly I believe that it should also be happening at the early learning level because we want to ensure safety within our facilities there as well. But needless to say, from those public meetings, the governor has required quarterly meetings to occur beyond those 3 public meetings so that these groups are constantly convening together to have discussions around how do we improve safety within these environments, but I think more importantly, how are we ensuring that the necessary services and supports are available? So the goal with our data collection system is to aggregate that data and present that data at those meetings, those quarterly meetings that were developed through the executive orders, where all the leadership within that particular circuit can see what are the key cases that have been escalated up that has resulted in the need for additional supports. And based upon what those data trends, gaps, and analysis, what that results in, can hopefully provide greater voice to the need for additional services, money, supports, what have you. We feel that this is a great connection to how the work that we're doing through this interagency agreement is now going to be adding value to other initiatives, particularly through the governor's executive order. Hopefully I made sense when I said all that. But this is a key piece to the work because knowing what the data is telling us can help us become more effective and hopefully efficient in the work that we're doing, but more importantly, continue to strengthen our communication and coordination efforts. Next slide, please. So opportunities. As we present this process framework, we're encouraging all of our system partners to consider how this can be integrated to strengthen information sharing in school safety or facility safety. Those, I think, schools can be used interchangeably here, but we see this as an opportunity. How do we integrate this process framework into our existing work, knowing that it can add value? Again, the opportunity to capture data patterns, trends, and make evidence-based recommendations. I previously talked about the executive order stuff, and I put a listing there because, again, we see this agreement having additional value to not only the work of the Children's Cabinet, but also to the work that's happening as a result of the executive order. And that all the information gathered from this approach is used to refine, improve, and strengthen our policies, practice, and procedures related to system of care and interagency coordination. Next slide, please. So this slide proposed some questions to you. I've had a lot of conversations with Rebecca around, many times when we talk about this interagency agreement, we typically talk about issues that may involve kids in DJJ that now come into child welfare or vice versa, children who may have developmental disabilities or unique needs that may involve the Agency for Persons with Disabilities and the child may have gotten arrested or been placed into the child welfare system. But we've talked a lot about what are unique scenarios or situations where this process framework can be of value to our early learning partners. A child may be having issues within the program. There's considerations for expulsion. You may follow your process related to that, but maybe the needs are beyond what you guys can offer. How can this interagency agreement process framework provide assistance and support to the work that you do that can resolve those issues and get that child ready to learn within your program? Again, the question already came up about the monthly meetings, but how can these monthly meetings assist your efforts in building or updating your resource directories? For our folks with CCR&R that may be on the phone, you guys do a lot of great work in helping families connect and navigate different things. How can this process add value to your work by helping increase or enhance your directory of services so that when issues arise or something comes up within the family, kind of where we can point the family in the right direction? And the last question that's there is, are there other needs or issues, whether it be communication or coordination, that this interagency agreement or the process framework can assist your efforts? Rebecca and I have talked a lot about how when a child comes into foster care and then they're placed within an early learning center, how can more information be provided from DCF around what assessments or resources or referrals have been made so that when that child comes into your program, we already have a good sense of what that is so that we're not having to duplicate services. If anything, we can begin to find out maybe what's missing or what else needs to happen in order to get that child ready to learn to achieve within our program. So, if you have a question, please utilize the question feature, but I encourage all of you to kind of think about that. We'd really love a scenario or two where you think this process framework could really help you all out so that we can educate our other agency partners around the work of early learning. What are unique situations that they may deal with that may result in why they would seek assistance from a local review team? But more importantly, too, even the last bullet of what are the other needs or issues that you're dealing with that from our agency partners that maybe we can assist in communicating and helping you pull the right people together to resolve that so there's greater communication and coordination in your area. So we wanted to provide these questions to you for your consideration and to seek your support. If something comes up, please let us know. We want to look at all this and assist your efforts. Earlier, I highlighted the handout around the quick reference guide. And if you happen to have that open, if you look under the education icon, the arrow coming out of the education icon, it actually identifies, who are points of contact for early learning services. I think we listed them on the back of that document, but we wanted to provide our agency partners with this information because there may be cases where they're dealing with a child who has a younger sibling who may or may not even be enrolled in early learning services. So if that's not the case, how can we help facilitate the connection? Because we want that child to be in a great environment, a safe environment where they're learning. as compared to maybe just sitting at home and not getting anything there. So again, we wanted to provide that information because as we look at individual cases, our goal too is to look holistically at how do we even prevent maybe those younger siblings from having similar issues as they get older, where if we can intervene early, we know that it saves money, but more importantly, that hopefully keeps the child in the process of being ready to learn to achieve. So we wanted to provide these 3 questions for your review, and to encourage each of you to please share your thoughts and any questions that you may have related to this as we work to continue to refine, improve, and strengthen this interagency agreement. Next slide, please. All right, so here on this sheet is a list of all of our agency points of contact at the state level. As I mentioned, Rebecca Amnod has been a great partner in this process. We're so thankful for her participation at the state level on our review team, and would encourage all of you, should you have any questions about the interagency agreement, please do not hesitate to reach out to her. She's a great point of contact, and I can tell you, if she doesn't know the answer, she knows who she can go to get the answer. And really, that's what it's all about, is helping figure out who's the right person to talk to so that we can resolve these cases. All right? I think the next slide is the last slide, which is my thanks to each of you for all that you do in supporting our young children in our state to help them not only achieve while they're with you, but help them to be prepared to transition to adulthood. You guys are creating a great foundation, and we're so thankful for the work that you do, and we continually want to support your efforts in identifying ways in which we can strengthen our work that enables our kids to grow up healthy, safe, and ready to transition to adulthood where they can become productive and self-sufficient. So thankful for all that you do. Thank you guys so much. And Rebecca and Lisette, thank you so much for the opportunity.
Well, thanks so much, Zach. We do have another question, if you don't mind, before we wrap things up.
Sure.
It's kind of a long question, so I'm going to try to paraphrase it, and hopefully I'm paraphrasing it correctly. But I think you can speak on this because it's asking about the Children's Cabinet, and I know the Children's Cabinet has some very specific priorities that they've all agreed on, but the question is asking about the Children's Cabinet and if they're advocating for increases in early care and intervention in the lives of children and assisting to develop a plan to invest earlier in those lives, anticipating a reduction in expenses later. So putting the dollars in prevention. So I think you could probably speak on those priorities that the Cabinet agreed on, and I think that'll address that.
Thank you, Rebecca, and thank you for that question. Yes, the Children's Cabinet, through our strategic planning retreat that we had last year, identified 3 key priorities for the state as it relates to children. The first one is a focus on early care and education. So early learning, the development and education is really a key focus that came out of that strategic planning meeting. Also, too, is a focus on children who are living in poverty. We know that poverty helps many times exacerbates issues, and we really want to look at how do we address the needs of children who are living in poverty, and many times it's really trying to work with those families. So that is our second key priority area, and the third priority area is mental health and substance misuse. So those are our 3 priorities, and as it relates to our early childhood development and education focus, that's where we're working very closely with the Office of Early Learning to see what else can we do to support those efforts. I can tell you that there's nothing concrete yet as it relates to further investments, but I can tell you we're currently working with the Office of Early Learning and looking at a federal grant to really do a broad needs assessment around birth to 5-year-olds to really see what is going on in our state related to that. Where are the connections that are currently existing? Where are they missing? How do we pull them together, and how can this framework assist us in doing that as a way of further identifying opportunities where could future investments be placed that result in really that focus on prevention and early intervention so that as kids grow up, they're not having these issues as they get older and us looking at each other saying, what happened? We know that there has to be more emphasis on that. Depending upon how the election turns out. Currently, the governor who was identified as the winner on the day of the election has 2 young children. And I can tell you that I am looking forward to my conversation with him around his focus on early learning, because he has 2 young children. And because of that is where I hope to really get his support to really think about the role early learning plays and the investments that we need to make in order to create a stronger and safer Florida for the future. So there's nothing concrete yet, but that is certainly forthcoming. And hopefully at a future webinar or in one of the OEL newsletters, we'll have an opportunity to share more information on that.
Thank you, Zach. And we do have just one more question
Sure.
that has come through. And it says, well, there may have been more, but I think this one's important. So knowing every child that is served by DCF or child welfare has been exposed to some sort of trauma, why isn't mental health counseling referrals automatically provided at intake? It says many of these children are in early child care settings and have challenging behaviors and concerns and are at risk of suspension and expulsion, and these mental health resources are really a great need, especially in the rural areas where the resources may be limited. I don't know if you're able to speak on that.
Well, I can't give a definitive answer, but the question is right on target. I think we as a state need to continue to look at how are we providing intervention services once children are removed from their families. We know they've experienced a lot of adversity and trauma in their lives, and how do we begin to intervene by providing services early on that can further mitigate that and hopefully build resilience to future stressors, but more importantly, that enables the child to stay focused on what they need to do within school as it relates to their behaviors, so on and so forth, that enables them to stay in school, but then more importantly, the ability to achieve. Again, I think that's certainly a question, Rebecca, you and I can bring back to our state review team, specifically maybe talking to the Department of Children and Families and their substance abuse mental health office. I know they are working to create a children's mental health system. That's been a big focus of theirs. And I think the question that was asked really fits in beautifully with the need of instead of waiting, that we're making these referrals for services to get the kids the help that they need. And as I say all that too, I think it also comes down to working with our Agency for Healthcare Administration to ensure that we have sufficient number of providers that can actually deliver high quality services. For those that are in the rural areas, many of you already know that we have a lack of services and supports in our areas sometimes. And for us to access services, the family may be required to travel to maybe the larger municipality within their area. And we know that presents a lot of challenges. So we're continuing to explore different opportunities. Telehealth services is certainly something that's been talked a lot, telepsychiatry, so on and so forth, as interventions to certainly support our rural communities, but particularly those areas that may have a lack of resources. I would have to say that more information will be forthcoming on that question, as it's certainly a legitimate question and certainly key to the work that we're doing when it comes to prevention and early intervention. Because if we know that's taking place, we need to have things in place in order to address those needs.
Thank you, Zach. I know there's always some tough questions because resources are limited and there's not always easy answers, but I think it's because of this framework that we have in the interagency work group that we're able to go to our partners and discuss those and try to find solutions to those gaps. So
absolutely. And I would say too, Rebecca, that we encourage the folks who are on this webinar and certainly to please share this with your colleagues. And any questions you have, please get with Rebecca. I emphasize that because she plays a key role on our state review team and is a great resource for you, and certainly has the ability to bring it to the larger group for discussion and strategies on how do we address this effectively to mitigate the needs of kids and the issues that they're experiencing.
Great. Thanks, Zach. So just to wrap things up, we will follow up with everyone on the call with some contact information for folks in your local area so you can reach out to them and become involved in your local review team. We certainly encourage that you do make that connection to your local review team representative and get involved and see how early learning and how you can fit into what they're already doing and bring in that early intervention and prevention piece that we're supposed to be focusing on with the revised agreement that went into effect last year, and really pour more into that, the prevention and early intervention, since that's what we focus so well on. Zach, thanks so much for joining us today. If there's any questions that have come through the question box that we weren't able to address, we'll try to follow up with you all after the call since we are now out of time. Zach's contact information is still on the screen if you'd like to reach out to him. And you have our information here at the Office of Early Learning, but we'll be following up.
And just a reminder that we will be posting this webinar on our website.
Yes, it'll be posted and we'll let you know when it's up.
Yes. Thank you, everybody, and we'll see you next month. Or hear you.
Yeah. We'll see you virtually next month. Have a happy Thanksgiving, everyone.
Bye-bye,
Thank you.
Bye.
Bye-bye. Thank you, ladies.
Thanks, Zach.